The next big topic is this. This is almost the most important thing in the entire field, and also the main reason why there has been a shift from external to internal fixation systems. Because you want to avoid exactly this risk. That can end in very dramatic cases, or rather, then of course there's also the failure of the extension. In a situation that could possibly be worse than the initial situation, you always want to avoid that. That means in aesthetic procedures, you always want to avoid that. The situation that arises could possibly be worse than the initial situation. That means we need to avoid an infection at all costs. If we now look at the internal, when we look at fixation systems, meaning the nails, we see that with all nails, there is no connection to the outside world. This applies to all nails. They have no connection to the body surface, and therefore not to the germ-colonized skin. And accordingly, the risk of infection in this area, equivalent and identical. It's not zero, but it's equivalent.
Almost exclusively related to the surgical procedure, to the phase of wound healing. After that, basically, there's nothing more to expect.
Exactly. But
how is the sword of Damocles? Always, yes.
We need to clearly separate them from the external fixation systems. The external fixation systems all have a connection to the skin surface. And in the worst case, not only that, but they also have foreign material in the medullary cavity with a connection to the body surface, which is the worst case scenario. Accordingly, they not only have a high risk of infection during the operation, but also permanently throughout the entire extension cycle. The risk of infection
through the connection of external and internal fixators. And the risk increases for the infection exponentially with the duration of placement, with the duration of the fixator. That's why there's an effort to use only the nail as the stabilizing element in lawn as quickly as possible, and to remove the fixator as quickly as possible. Still, the microbial load was there. In the whole weeks of extension,